Assalamu alaikum. Hello everybody. Today our video is about how to diagnose rheumatoid arthritis. Rheumatoid arthritis manifests as a symmetrical arthritis, most commonly affecting the hands. If the pattern of the disease is not symmetrical, then a different diagnosis should be considered. In early rheumatoid, there may be no changes visible on an X-ray. Ultrasound can be used to look for erosions, synovitis, and tenosynovitis. In rheumatoid arthritis, the synovium of a joint proliferates and becomes thickened. This synovial proliferation is also known as pannus. Increased blood flow seen on Doppler ultrasound indicates active inflammation. Key features include erosions, synovitis or pannus, deformity, and symmetrical pattern. This is an ultrasound image of metacarpophalangeal joint erosion, showing a large erosion is seen at the margin of the joint pannus, which is synovial proliferation is seen filling the joint capsule. And this is a Doppler ultrasound of metacarpophalangeal joint erosion. Use of Doppler ultrasound shows there is increased blood flow within soft tissues of the joint capsule, indicating active inflammatory synovitis. This erosion at the metacarpophalangeal joint wasn't visible on X-ray images in this patient. As rheumatoid progresses, the marginal erosions become visible on X-ray images. Marginal erosions. Large erosions have formed at the margins of the thumb metacarpophalangeal joint. The marginal erosions seen in rheumatoid arthritis differ from the subcortical cysts seen in osteoarthritis, which are located deep to the articular surfaces of the joints. As the disease progresses, further the joints become unstable and sublux, partially dislocate. Ulnar deviation is a characteristic feature of rheumatoid arthritis in the hands. This is the phenomena of subluxation of the proximal phalanges at the metacarpophalangeal joints with deviation of the fingers toward the ulnar side. Severe rheumatoid ulnar deviation. The joint spaces of the wrist are narrowed and there is severe erosion of the carpal bones. At the metacarpophalangeal joints, the tendons of the hand pull the subluxed fingers towards the ulnar side. This correlates with the clinical sign of ulnar deviation. Rheumatoid arthritis may also affect the large joints of the body, such as the hip, knee, and shoulder. Rheumatoid of the shoulder. Large periarticular erosions have formed around the humeral head. Erosion of the distal clavicle, a classic feature of advanced rheumatoid arthritis affecting the shoulder, causes widening of the acromioclavicular joint. Rheumatoid of the hip, protrusio acetabular. The acetabulum is eroded such that the femoral head, red line, encroaches medial to the inner rim of the pelvis, green line, compared to the normal position of the right femoral head, white line. Protrusio acetabuli, protrusion of the femoral head medially through the acetabulum, is a classic feature of advanced rheumatoid arthritis affecting the hip. Atlantoaxial subluxation. Rheumatoid arthritis can result in erosion of the odontoid peak in the cervical spine. The odontoid peak becomes more pointed than normal due to erosion resulting in a candy-legged appearance. These lateral images of the cervical spine, taken with the neck inflection and extension, show a large gap forming between the odontoid peak and the anterior arch of the atlas on flexion. This gap indicates that the stabilizing ligaments of the anterior atlantoaxial joint are no longer intact.